Hi, today I'm going to tell you about the vagus nerve stimulation. Let's start. First, this is the classification of the nervous system. When you follow this line, nervous system, peripheral nervous system, autonomic nervous system, you get to parasympathetic nervous system, and the parasympathetic nervous system is often called the vagus nervous system. And known effects of the vagus nerve stimulation. The vagus nerve stimulation is often called the rest and digest or feed and breathe signs, and literally this signs show when resting or digesting, feeding or breathing. And also sexual arousal, salivation, lacrimation, urination, digestion, and defecation. In cases of these things, you can think that the vagus nerve was stimulated. Examining the effect of the vagus nerve stimulation. This is the title of a simulation experiment in the simulation program PhysioX, and I'm gonna explain you about this experiment. First, objectives: to understand the role that the sympathetic and parasympathetic nerve systems have on heart activity, and second, to explain the consequences of vagal stimulation and vagal escape. Third, to explain the functionality of the sinoatrial nerve. And second material, as I said, we use PhysioX 2.9.0. And third method, we have this heart of a frog, and this whitey thing is the vagus nerve, and the vagus nerve stimulation electrode. I'm going to put this in the power and connect it to the vagus nerve. As I said, it is plugged in, and it is connected to the vagus nerve. We put the power on so that this yellowish electricity is stimulating the heart, and you may have realized the heart rate was 61 point in the normal status, and it decreased a little. And the decrease continues, then the heart stops for 3 seconds, and when we hit the stop stimuli button, it starts to beat again in 5 seconds. This is the end of the experiment, and finishing the experiment, I had 2 questions in my head. The first one was, are there any other signs representing the vagus nerve stimulation? Since we have a lot of signs representing the vagus nerve stimulation, I thought there would be anything more. And the second was, can't we use the vagus nerve stimulation for clinical cases as a treatment for disorders? I heard something about depression and things from my professor, so I looked up for these things in the web, and I found 2 papers about this. And it was auricular transcutaneous vagus nerve stimulation, often called as TVNS. It is a new treatment for major depressive disorder, short abbreviated as MDD. Current treatments of major depressive disorders are first drugs, and second counseling, and electric shock. And this is just putting an electric shock in your body. But these current treatments have weaknesses, and there are 3 weaknesses. Current treatments have, first, high non-response rate, meaning that it doesn't work at all. And second, high relapse rate. The possibility is very high of getting the disorder again later. And the third, frequent intolerable side effects. And additionally, there are actually vagus nerve stimulation done in some hospitals, but these are not transcutaneous vagus nerve stimulation, so they involve surgery, and because it involves surgery, there are perioperative risks, potentially significant side effects. So these are the limitations of current vagus nerve stimulation, and auricular TVNS shows the answer for this. This picture is the distribution of the vagus nerve in our body, and this is the ear part of the vagus nerve. And this green tree-ish thing is the vagus nerve distribution in our ear. I forget this T and V and S. We're going to just look at T, V, and S. This red spots are the spots we're going to stimulate during the experiment. Then why auricular T, V, and S? What's so good about this? Auricular T, V, and S have significant and clinically meaningful antidepressant effects. So it's good, and it is the long-term sustained benefits. This effects are long-term sustained. And the trial procedures. First, recruitment, screening, and consent form. Gathering samples and gathering consent from the samples so we can proceed the experiment. And next, pre-treatment, psychiatric and psychophysiological measurements. We need to know the status before the treatments in order to find out whether it improves or not. And third, randomization, meaning distributing the samples in random status. And we divided the samples into 22 samples and 15 samples. For the 22 samples, we're going to divide it into 11 samples of TVNS group and 11 samples of sham TVNS group, meaning fake TVNS group. And after doing this, we do the experiment and get the post-treatment psychiatric and physiological measurements in order to find out whether it improved or not. And for this 15 samples, same 7 samples of TVNS and 8 samples of sham. And also get the post-treatment measurements. I call the 22 samples as study 1 and the 15 samples study 2. Study 1, there are 22 samples, 11 TVNS samples and 11 sham samples. We stimulate 15 minutes once a day, only once a day, and we use NET 2000 device in order to stimulate. And for study 2, we have 15 samples, and we stimulate twice a day, and we use NET 1000 for stimulation. It's just the device name. And this net sheet thing is the vagus nerve, and this is the NET 1000, 2000, whatever. And this is the sample patients, information, gender, age, and other things, education level. And after doing this experiment, we got this data. And we try to explain the effect with two depression rating scales. First, HAM-D scale, second, BGI scale, and the HAM-D scale is Hamilton Depression Rating Scale. It is multiple item questionnaire used to provide an indication of depression, and it is done by an interviewer. And it is designed for adults, used to rate the severity of depression, and it is focused on the symptoms of depression like mood, feelings of guilt, suicidal ideation, insomnia, agitation, retardation, anxiety, weight loss, and somatic symptoms, etc. And we look the HAM-D pre-post difference. Pre 50.4 for the TVNS group, 10.6, -4, and just like this. For study 1 is this, for study 2 is this, and this is for study 1 and 2. But unfortunately, they could not find any significant difference between the TVNS and sham group using the HAM-D scale. So we use the BDI scale, and they try to find the difference. And BDI scale is the back depression inventory, and 21 question multiple choice self-report inventory, and used to measure the severity of depression. Designed for individuals aged 13 and over, symptoms of depression, hopelessness, irritability, guilt, weight loss, fatigue, lack of interest in sex. And as you see, the star shows the difference. These numbers are very different, so it means that there are very significant difference between TVNS and the sham, meaning that there were some effects of TVNS. And we graphed the data and showed significant decrease of BDI scores. But there were limitations on HAM-D scale, too small sample size, only 37 samples, too short trial period. We did only for 2 weeks. And placebo effects, people might think they are TVNS even though they aren't actually. And use different device for study 1 and study 2. Study 1 we use Med 2000 and study 2 we use Med 10. Even a little, it might make an error. Summary and opinion. Vagus nerve stimulation can make a significant change in humans' body. For example, as shown above, it can change the rhythm of your heartbeat. Also, it can control your people's mood. And there are many more examples of stimulating the vagus nerve fiber for clinical use. But these methods are not very popular. That's the problem. I strongly suggest that physicians should study more about the vagus nerve stimulation techniques and use as a treatment for many people who are in pain. And this is the end of my presentation.
Thank you.